So one score which has been asked in this AIMS November 2018 exam was the Silverman Score. You were given a scenario where a neonate had severe respiratory distress and you were asked to do the Silverman scoring for that neonate. So we now discuss about some very important scores that are used in neonates. So the most important of them is the Apgar score. You are given case scenarios where you may be asked to calculate what the Apgar score is. So we need to know the components of Apgar score in detail. Okay. So the components of Apgar score you can remember by the name Apgar itself. Okay. So let us see how. So there are 5 components: A, P, G, A and R. Okay. So A stands for appearance, P for pulse rate, G is for grimace, another A is for activity, and R is for respiratory effort. Remember, R is for respiration or respiratory effort, but not respiratory rate. It has come as a question previously. All of the following are components of Apgar score except. So the answer is usually respiratory rate. Respiratory rate is not a component of Apgar score. It is the respiratory effort or respiration which is a component. Okay. So each of them can be given a score of 0, 1 or 2. Okay. So appearance, we give it a score of 0 if the baby is completely blue or completely pale. Okay. We give it a score of 1 if the body is pink but extremities are blue, like peripheral cyanosis. And we give it a score of 2 if the baby is completely pink. Okay. Now pulse rate. We give it a score of 0 if the pulse rate is absent. You are not able to feel a pulse rate. We give it a score of 1 if the pulse rate is less than 100 per minute. While we give it a score of 2 if the pulse rate is more than 100 per minute. By grimace, we refer to response to stimulation by a catheter. So if you insert a catheter or a feeding tube in the oropharynx of the baby and see what is baby's response to it. Okay. So grimace basically refers to response to stimulation of oropharynx by a catheter or a feeding tube. Okay. So if you insert a catheter or feeding tube in the oropharynx but the baby shows no response, you give it a score of 0. You give it a score of 1 if the baby grimaces only. That means there is just some change in expression and nothing much more than that. So if the baby grimaces only, just some change in expression, you give it a score of 1. But if it is an active baby, what will happen if you are inserting something in the oropharynx of the baby will start coughing or sneezing. So if the baby coughs or sneezes, you give it a score of 2. Okay. Now coming to the activity, you give it a score of 0 if the baby is lying completely limp or flaccid. Baby is lying completely limp or flaccid. That means no tone at all. The limbs are lying completely loose and lax, limp and flaccid. You give it a score of 0. You give it a score of 1 if there is some flexion of limbs present. Okay. While you give it a score of 2 if it is a well-flexed posture with normal limb movements. Okay, if it is actively moving baby. So actively moving baby, then you give it a score of 2. Well-flexed posture with active movement of limbs. You give it a score of 2. Right? Respiratory effort, you give it a score of 0 if there are no respiratory efforts, none. You give it a score of 2 if the respiratory efforts are there but they are slow and irregular. Slow and irregular, you give a score of 1. While you give it a score of 2 if there are normal or strong respiratory efforts. Okay. So normal or strong respiratory efforts, then you give it a score of 2. So that is how you do the Apgar score. So you can see there are 5 components of Apgar score. A for appearance, P for pulse rate, G for grimace, another A for activity, and R for respiratory effort and not respiratory rate. Each of the components can be given a score of 0, 1 or 2. So what is the maximum possible score in Apgar score? So the maximum possible score is 10, right? And the minimum possible score is 0. Okay. So you want a higher Apgar score or a lower Apgar score? A higher Apgar score. So Apgar score more than 7 is usually taken as normal, while Apgar score of 0 to 3 indicates a severely depressed baby. So not the psychiatry wala depression, severe birth asphyxia. Okay, 0 to 3 is seen in severe birth asphyxia. Okay. A few important things that we need to know or remember about Apgar score is, if you have ever seen the birth documents of a neonate, you would see that we usually document Apgar score at 1 minute of life and at 5 minutes of life. Okay. So Apgar score is usually documented. So Apgar score documented at 1 minute and 5 minutes of life. But if you try to recollect the neonatal resuscitation guidelines, do you remember anywhere did we mention that if the Apgar score is this, then do this? No, right? So Apgar score as such plays no role in neonatal resuscitation. Okay? So it is always calculated retrospectively. It is usually calculated retrospectively. Later, when you finish the resuscitation, then you calculate it and it is documented because it has prognostic importance. It helps in predicting the outcome of the baby, whether the baby will have a normal neurological outcome or 0 to 3 then poor neurological outcome and so on. Okay. So Apgar score has no role in neonatal resuscitation. No role in neonatal resuscitation per se. But it has prognostic importance. Helps in predicting the outcome. Okay. So that is about the Apgar score. Now there are some more scores which are important from neonatology for us. So one score which has been asked in this AIMS November 2018 exam was the Silverman score. You were given a scenario where a neonate had severe respiratory distress and you were asked to do the Silverman scoring for that neonate. So let us see what are the components of Silverman score. Okay, so what are the scores used to assess respiratory distress? So scores used to assess respiratory distress in a preterm neonate, the score used to assess respiratory distress is called Silverman score. While in a term neonate, the score used to assess respiratory distress is usually the Downey's score. Okay. So Silverman score we need to know in some more detail. So basically both the Silverman score and the Downey score have 5 components each. Okay, just like the Apgar score. And each of them are given a score of 0, 1 and 2. Again, so minimum score 0, maximum score 10. So let us see how the Silverman score goes. So the components of Silverman score very easy to remember. So there are 3 retractions: upper chest retractions, lower chest retractions, zippy sternal retractions, and apart from that, nasal flare and grunt. Okay. So the components are upper chest retractions, lower chest retractions, zippy sternal retractions, nasal flare, and grunt. Okay. So let us see how this scoring is done. So again you have a score of 0, 1 or 2. So upper chest retraction, basically you compare the movement of chest and abdomen. Okay. So first let us see how that happens. So if this is a neonate lying supine, so this is the chest and this is the abdomen. Okay. Now upper chest retractions, basically you know what happens is normally the chest and the abdomen both will rise together and almost equally during respiration. So that will be a score of 0. If the abdomen rises but there is a lag in the chest wall rise, so if the abdomen is rising so much but the chest wall is rising only this much, lag of chest wall, it is not able to rise as much as the abdomen is rising, then it is score 1. Okay, and if there is a seesaw kind of motion, that means you know it is totally opposite. The chest and abdomen are moving in an opposite direction. If chest is going out, abdomen is going in, and while if chest is going in, abdomen is going out, then it is seesaw or paradoxical movement, that is severe respiratory distress, given a score of 2. So score 0 is when chest and abdomen rise together and almost equally. So chest and abdomen rise together. You give a score of 1 where chest wall lags behind. Okay. While you give it a score of 2 where there is paradoxical or seesaw movement, chest wall and abdomen move in opposite directions. So seesaw kind of movement pattern is there, or paradoxical breathing, then it is given a score of 2. Okay. Severe respiratory distress. Now lower chest retraction, zippy sternal retraction, nasal flare, very simple. Absent, minimal, marked. So lower chest retraction, you give it a score of 0 if it is absent. You give it a score of 0 if lower chest retraction is there but minimal. And you give it a score of 2 if it is marked. Similarly, zippy sternal retractions absent, minimal, marked. Similarly, nasal flare absent, minimal, marked. Now what about grunt? So if there is no grunt, you give it a score of 0. But if there is grunt but it is audible only with stethoscope, so audible only with stethoscope, you give it a score of 1. And if the grunt is so much that it is audible even without stethoscope, you give it a score of 2. Okay. So these are the components of Silverman score. Very easy to remember. 3 retractions: upper chest retractions, lower chest retractions, episternal retractions. Okay. Nasal flare and grunt. So upper chest retraction, just you remember, 0, chest and abdomen rise together. You give it a score of 1 if abdomen is rising this much but chest is rising only this much. And you give it a score of 2 if when chest goes out, abdomen goes in. Chest goes in, abdomen goes out. Seesaw movement, then you give it a score of 2 for upper chest retractions. Rest all are very simple. Okay. So that is about the Silverman score. Again, the maximum possible score in Silverman score is 10 and minimum is 0. So here in Silverman score, do you want a higher score or a lesser score? So we want a lesser score, unlike Apgar score. Okay, in Silverman score, more the score, more is the respiratory distress in the baby. So we want a lower Silverman score, right? So Silverman score of 0 to 3 would be normal, and Silverman score more than 7 would indicate severe respiratory distress. Okay. Another important score in neonates about which we need to have some idea, that is called Downey score. Downey score is a score used to assess respiratory distress in neonates, just like the Silverman-Anderson score. But Silverman score is mostly useful for preterm babies with RDS, while Downey score is most commonly used for term neonates. Okay, but the pattern of scoring is similar to what we saw in the Silverman score. So what we have here again is our 5 components. Each of them can be given a score of 0, 1 or 2. Okay, so 0, 1 and 2, and then you calculate the final score accordingly, just like we did in the Silverman score. Okay, so 0, 1 and 2, and again there are 5 components as we mentioned. So let us see what are the 5 components of Downey score. So 1 is cyanosis. We give it a score of 0 if cyanosis is absent. Okay, we give it a score of 1 if cyanosis is present in room air. Present in room air. But on giving oxygen, it might subside. While we give it a score of 2 if the disease is so severe or respiratory distress is so severe that cyanosis is present even at FiO2 greater than equal to 40%. Okay, present at FiO2 greater than equal to 40%. Okay, another parameter that we use here is air entry. We give it a score of 0 if the air entry is normal, okay, or is well audible with stethoscope. We give it a score of 1 when the air entry appears to be decreased, okay, so decreased air entry. While we give it a score of 2 if the air entry is barely audible. Even when you put stethoscope on the chest of the baby, you can hardly hear about the air entry. So it is barely audible. Okay. Next component is the respiratory rate. So respiratory rate, we give it a score of 0 if the respiratory rate is less than 60 per minute. We give it a score of 1 if the respiratory rate is between 60 to 80 per minute, and 2 if the respiratory rate is more than 80 per minute. That means most severe form of respiratory distress. Grunt. You know what is grunt? So grunt is a noisy breathing. This noise is mainly during expiration when the baby is having respiratory distress. So it is something like So with each breath, there is an expiratory noise because the baby is not able to breathe properly. Okay. So grunt, we give it a score of 0 if grunt is absent. We give it a score of 1 if grunt is present but audible only with the help of a stethoscope. That means it's not too loud. Okay. Audible only with stethoscope. While we give it a score of 2 if the grunt is so loud that it is audible even without a stethoscope. Okay. So audible without a steth. So to naked ear it is audible. Alright. Now coming to retractions. So retractions, we give it a score of 0 if there are no retractions. Okay. None. We give it a score of 1 if the retractions are there but they are mild. And we give it a score of 2 if the retractions are severe. So as you can see, Downey score, just like Silverman score, has got 5 components, each of which can be given a score of 0, 1 or 2. So the minimum possible score in Downey score, when we give 0 to each component, it will be 0. And maximum possible score, when we give 2 to each component, it will be 10. Okay. So more the Downey score, more is the respiratory distress of the baby, just like the Silverman score. So a Downey score of more than 7 usually indicates severe respiratory distress. Alright. So remember, what are the components of Downey score? At least you must remember. So you can remember by the mnemonic CAR-GR. CAR-GR. Okay. So you have C for cyanosis, A for air entry, R for respiratory rate, G for grunt, and another R for retractions. Okay. So that is Downey score. Now recently in the JIPMER exam, May 2019, there was a question on the scores in neonates, like which of the following scores is used to assess respiratory distress in the neonates. So the options were Apgar score, Silverman score or Silverman-Anderson score, SNAP score and Crib score. So we all know out of these, Silverman score is the one used to assess respiratory distress in neonates, especially preterm neonates with RDS. Now a word about the Crib and the SNAP score, so that at least you know what it is. You need not go into the details, but you may be asked about the full form of the score or its utility in subsequent questions. So let us just see a little bit about it. So what is this Crib score? Now Crib is an acronym which stands for Clinical Risk Index for Babies. Okay. So this Crib is an acronym which stands for Clinical Risk Index for Babies. Okay. So you can see Crib, Clinical Risk Index for Babies. This is a score that predicts the risk of mortality of a baby in NICU. So it is used for critically sick neonates. Okay. Score used to predict mortality of neonates in ICU. Okay. Mortality of neonates in ICU. Okay. So basically it compares the performance of various NICUs. It gives an idea about how well that NICU is functioning. So it is used to compare performance of different NICUs. Okay. So remember, it is Clinical Risk Index for Babies. And what about SNAP score? So SNAP score is another score which is again an acronym that stands for Score for Neonatal Acute Physiology. So it stands for Score for Neonatal Acute Physiology. Neonatal Acute Physiology. Okay. So this is again an acronym, you can see, Score for Neonatal Acute Physiology. Okay. This uses some 34 vital parameters. So uses 34 clinical signs as well as investigation findings. So uses 34 parameters which include vital signs and investigation findings. And it predicts mortality and morbidity for sick neonates. So predicts morbidity and mortality for neonates. Okay, so these are some important scores in neonatology. Apart from that, of course, you have the expanded new Apgar score, which we have discussed in detail in the section on preterm neonates. Okay.